sure that those resources are fair and trustworthy. There are many resources on our website. If you would like, please, I encourage all of you to look at past tutorials, webinars, and other educational resources that are available on our repository website. Next slide. NIDDK Central Repository is part of the broader NIH and NIDDK data ecosystem. We're not here alone, and we are looking and always making effort to link the resources that we have in-house with resources that reside elsewhere. And we continue to expand every day. One of the things that will help and will maximize that is the privacy preserving record linkage that we will be talking about today. Next slide. One of the things that we are also working on is an analytics workbench. The workbench will facilitate, hopefully, and streamline data access, minimizing data movement, and also allowing us to do more. One of the things that we are looking to do with that as well is the data challenge as part of the data challenge activities that we're working on. And with that, we will allow participants and challenge managers to have resources to utilize all those resources and continue to maximize the utilization of resources for AI innovation. Next slide.
Rebecca, very quickly, Anya, can you try resharing your slides? It doesn't seem to be showing up for the attendees.
Yep. Is it visible now?
Excellent. Apologies for that, should have verified. So next things are the goals of the data challenge and the centric series. One of the things that we're doing as part of the modernization efforts and the approach part of this series is that we're developing approaches and models and methods to increase data interoperability and usability for artificial intelligence and machine learning applications. That includes the data challenge series and this webinar series. This will help us augment and enhance existing data for future research use and discover innovative approaches that enhance the utility of the resources that we have within our system. We encourage all of you to visit our website for more information on future and past data challenges and for more information about other activities that we have. Next slide. Specific to this series, today is another installment of the series that we're hosting every month. What we are trying to do with this series is to accelerate data science for AI-driven biomedical research that fosters collaboration between the researchers themselves and experts in the field. Today, we're going to have conversations by two experts in privacy-preserving items, and every month, on the last Thursday of the month, we are hosting this series. Upcoming topics are going to be the challenges and opportunities and other considerations for secondary researchers when it comes to EHR data and other real-world resources, as well as later in August, we are hoping to have impact and innovations that have been realized with resources from the repository website or from the central repository. If you want to learn more and also look at prior webinars, please visit our website. All the past recordings are stored there, and you will have access to all the associated materials. Next slide. Without further ado, of course, I want to introduce all of you to today's experts, and that is Anya Davic and Shruti Gautam. Anya is the health data scientist at Booz Allen Hamilton, and she specializes in scientific data management and stewardship. She has co-authored 2 public reports for NIH that are on the feasibility of leveraging privacy-preserving record linkage, or PPRLs, for pediatric disease across HHS. And she also has supported various data management and sharing programs within NIH to promote or support fair and trust principles. She also supports the NIDDK Central Repository, and we're very happy to have her. Then Shruti Gautam. She is a bioinformatician and cloud platform developer, also at Booz Allen Hamilton, and she supports genomic surveillance and outbreak detection efforts across the CDC. She also is part of the Advanced Molecular Detection Program. And as part of the work, she has supported she has done items on safeguarding privacy while supporting data sharing and data linkage. She has also supported other NIH institutes such as NIAID and sister agencies such as the VA. Okay, I'll pass it on to you.
Thanks, Rebecca, and hopefully everybody can see my screen. So this afternoon, we are going to be covering different privacy-preserving methodologies and its implications for researchers. Today's agenda will first talk about the importance of participant confidentiality and data privacy, and then we'll be focusing on 2 privacy-enhancing technologies, the first being privacy-preserving record linkage, or PPRL. So we'll talk about what is record linkage, what is PPRL, and the differences between those two, some benefits and use cases of PPRL, what are the essential elements for implementing PPRL and the requirements, and what are some open source resources for researchers who may be interested in implementing PPRL themselves. And then the second privacy-enhancing technology we'll talk about is differential privacy. So we'll talk about the benefits of this methodology, a couple of real-world use cases, and walk through an example at NIH. And then we'll also be covering an overview of the underlying math at a high level, and then also go through the process of synthetic data set generation using differential privacy. So to kick off this discussion on privacy-preserving methodologies, we wanted to first define these 2 related concepts, which is participant confidentiality and data privacy. So they are related concepts in protecting research participants, but they focus on different aspects of data handling and protection. So participant confidentiality refers to the ethical and legal obligation of researchers to protect the identity and personal information shared by research participants from unauthorized access or disclosure. So essentially it's saying it's the researcher's responsibility to safeguard sensitive data. So examples of safeguarding measures might include storing data on secure servers, protected by passwords, encryption, and access controls, removing direct identifiers like names, addresses, social security numbers, and replace those with codes. And this is done through a process called de-identification, which we'll talk more about in a bit. Certificates of confidentiality are another measure. These are automatically issued for NIH-funded studies collecting sensitive identifiable information, and they essentially prohibit the disclosure of protected information for non-research purposes to anyone not connected with the research. So for example, in court, your health information from participating in a study cannot be shared. And then in contrast, data privacy is about an individual's right to control their information and how it is shared, and under what circumstances the data is used. So in practice, this could include informing participants about what data will be collected, how it will be used, stored, and shared through consent forms. Giving participants the right to withdraw from the study and stop further data collection at any time, ensuring that data collection follows applicable laws. So, for example, the HIPAA privacy rule, and then requiring formal agreements, for example, data use agreements that limit how the data can be used when sharing with external researchers. So in summary, just in simple terms, confidentiality is the researcher's responsibility to protect what they know about participants, and then privacy is participants' right to decide what information about them is shared or collected. And both concepts are essential for ethical research and building trust between researchers and participants. So, for example, breach in confidentiality can also violate an individual's privacy. The NIH has specific policies and guidance on data management and sharing, emphasizing both the importance of data privacy and confidentiality. And this is covered in the NIH policy for data management and sharing, or the DMS policy. We won't go into the DMS policy in detail. There are many webinars and guidance posted on this topic, but the key idea is respecting participant privacy is essential and must align with informed consent, legal, and policy obligations. And some of the best practices set forth by NIH in the DMS policy to protect participant privacy is to apply appropriate de-identification while still preserving scientific value, establishing data use and data sharing agreements that outline oversight, responsibilities, and restrictions, and then also understanding and communicating legal protections, including the certificate of confidentiality, which we discussed on the previous slide. So another key concept, data de-identification. In addition to the governance that we discussed, such as data use agreements, certificates, data de-identification has traditionally been the primary method to anonymize data. So with regard to the HIPAA privacy rule, there are two de-identification methods. That is expert determination, which is a formal determination by a qualified expert, and then also the safe harbor method, which is the removal of specific individual identifiers that are considered protected health information by HIPAA. And data de-identification includes various techniques, including redacting, masking, recoding to anonymize participants. And just to go through quickly these three examples, redacting could be removing or deleting an entire variable from a data set. Masking could include replacing data with anonymized indicators. So, for example, James Smith admitted to hospital 2 hours after treatment, replacing James Smith with just a placeholder X's or a bracket name, just so you can still maintain the semantics and context of the data without revealing somebody's identity. And then recoding includes applying a random code to anonymize data. So, for example, changing site names like Montgomery Hospital to a coded list so that those locations are not shared to external researchers. So the key message here is there are several terms and techniques for de-identification, and the main goal is to protect participants' identity. So some of the challenges maintaining participant privacy, while de-identification aims to obscure or remove all PII to protect a participant's privacy, it has to be done correctly and sometimes does not address all the challenges associated with protecting patient privacy. So especially in the era of big data in medical informatics, where organizations are looking to pool data from multiple sources in order to build a complete picture of a patient's health and treatment. This brings upon additional challenges related to re-identification, and we'll just go through these main challenges here and some of the implications. So the first challenge In order to link data sets across sources, so for example, you want to link EHR data to a research data set that has overlapping participants, traditional record linkage requires sharing of direct identifiers, so things like name, birth dates, social security number, which creates privacy risks. And even if identifiers are not explicitly shared, there could be patterns in what's called quasi-identifiers. So, for example, combinations of zip code, birth date, gender can also be used to uniquely identify individuals, especially in small or sensitive populations. And so if these identifiers or linkage keys are exposed during this process, you could have malicious actors that could re-identify individuals, or this could even be done accidentally, inadvertently, linking them to sensitive health or personal data. The second challenge is when researchers want to combine data across organizations, but laws like HIPAA, or if there's like study-specific governance like consent that limits sharing, or the movement of identifiable info, which limits that collaboration. And then the third challenge is every time a new data set is linked, the number of unique identifiers, such as age, gender, location, this doesn't have to be considered PHI, but just unique identifiers. As the number of identifiers associated with the individual increases, the risk increases that this individual can be re-identified in the combined data set. And this is because the number of people sharing a set of characteristics decreases, meaning that there is a higher chance that individuals in that group can be identified, resulting in a higher de-identification risk. The fourth challenge is about even if data is de-identified, it can sometimes be reversed engineered through linkage attacks. So data re-identification has become a growing concern as machine learning models have become more adept at analyzing patterns in anonymized data sets. And then the fifth challenge, it's this sort of tug of war balance between utility and privacy, relating to challenge 3 as well. So when we increase privacy protections, for example, we do masking, noise injection, aggregation, we often reduce the data set's accuracy or granularity. But then at the same time, when we maximize data utility, so we have more detailed individual level data, we pull data on the same individual from various sources. At the same time, we're also increasing the re-identification risk. So the challenge there is how do you balance that utility and privacy considerations? And then the sixth challenge is re-identification could also occur when someone has access to external information, such as a publicly available database or information leaked from another source, which can be combined with the linked data to identify individuals. So again, data re-identification has become a growing concern as the overall amount of data on individuals has increased on the web and other publicly accessible areas. There's the famous example in the late 90s where researchers were able to re-identify a Massachusetts governor, his medical records using de-identified health data and then public voter registration data. And a more recent 2019 study published in Nature found that 99.98% of Americans could be correctly re-identified in any data set using just 15 demographic attributes. So this idea of de-identification, de-identifying data, sharing it and then not monitoring over time is not sufficient to maintain participant privacy. So what can be done to mitigate these challenges and preserve privacy while still maintaining data usability for research? And so this is where in comes the privacy enhancing technologies, or PETs. PETs are technologies, tools, techniques, and practices designed to protect an individual's privacy. They achieve this by safeguarding personal data during collection, storage, processing, linkage, and sharing. So in the biomedical research context, it enables researchers to really harness the value of detailed individual level data while protecting privacy. And then it also helps prevent not only, maybe intentional misuse of data through attackers, hackers, but also accidental or negligent misuses. And PETs are not a new concept. In fact, I think the first early mentions of PETs date back to the late 90s or early 2000s. However, with the explosion of AI, ML, and data-driven services, also support from policymakers and increased privacy awareness, we've seen a rise in the popularity of PETs. Also, there's been recent advancements in the availability of commercial and open source solutions that have made PETs more accessible, and we'll also be sharing examples of some of these. So these also enable responsible data use. And so for today's webinar, we'll be covering PPRL, which is privacy preserving record linkage and differential privacy. There are several other examples of PETs, and this webinar would be several hours if we covered all of them. But if attendees on this webinar are interested in learning more about a specific one, feel free to drop any comments in the chat, and we can definitely think about doing another webinar in this series on those topics. So now diving into privacy preserving record linkage. First talking about what is record linkage. So record linkage refers to the process of combining or bringing together two or more records that correspond to the same individual. And this is a fundamental technique used across many fields to create a more complete and accurate picture of a person's interactions, events, or characteristics as recorded in different data sets. The term record linkage was first introduced in 1946 by Halbert Dunn, who was with the U.S. National Bureau of Statistics, and he provided a memorable description of the concept. He said, each person in the world creates a book of life. This book starts with birth and ends with death. Record linkage is the name of the process of assembling the pages of this book into a volume. So this analogy highlights the importance of connecting the different pieces of information collected about a person over time and across systems. And in practice, many agencies have already been using record linkage for decades. So for example, the U.S. Census Bureau relies on it for accurate population estimates and demographic research. The CDC uses linkage to track health outcomes and disease trends. CMS and the Agency for Healthcare Research and Quality use record linkage to monitor healthcare quality, cost, and patient safety by linking claims data. And other agencies also use it as well. So overall, record linkage helps these agencies and many other agencies turn fragmented data into meaningful insights that can inform policy, improve healthcare service, advance research, and drive innovation. Now talking about privacy preserving record linkage, I first want to talk about what traditional record linkage entails. So traditional record linkage uses direct PII, such as name, social security number, address, date of birth, and other personal identifiers to identify the same person across data sources. So as I brought up earlier with the challenges slide, this creates privacy and confidentiality concerns since direct linkage requires the exchange or centralization of PII. And this increases the risk of data breaches and can also raise legal and ethical concerns, especially when you're linking data across agencies or organizations. Privacy preserving record linkage, which I'll refer to as PPRL moving forward, on the other hand, uses cryptographic hashing techniques to encode PII and generate tokens. And tokens are just random fixed length strings of characters and numbers. And these tokens are actually what's used to match records across different data sources. And without going too much into detail what cryptographic hashing entails, it's basically a one-way transformation design so that it's computationally infeasible to go backwards. That is to derive the original PII from the token, and then sometimes you can even add additional layers of privacy, like doing homomorphic encryption, just to further preserve privacy. Tokens that are generated from the same algorithm then, using the same combination of PII, will be identical across data sources so that you can actually match records on the same individual across data sources using the tokens without revealing the individual's identity. And this process overall is called token matching. So the key point here is the PII, the person's personal information, never actually leaves the data source, only the tokens do, and therefore privacy is preserved. So for example, if you're linking research data to EHR data in an EMR system, that EHR data and the identifiable information stays within the hospital system, and only the de-identified tokens leave the data source. This is another illustrative example of PPRL. So you have data source 1 and data source 2 that have overlapping participants, and each data source generates tokens using the same PPRL tool, and then those de-identified tokens are used to link records across the two data sources. So when we talk about PPRL, one key distinction is whether we're using a two-party or a three-party linkage model. In a two-party PPRL model, we have two data custodians. So let's say these are two organizations or agencies that want to link their data sets. They would work together directly to perform the linkage using PPRL, and then the two parties coordinate to compute the matches securely using just the tokens without ever sharing unencrypted sensitive data with each other. In contrast, there is a three-party PPRL model, which introduces a third independent party, often called a trusted broker, honest broker. And in this setup, the two data custodians will send their encoded or encrypted data to this third party, so the tokens, and then the third party runs the matching process on the tokens and returns only the results. And this is typically in the form of matched record IDs or a linkage map. So the honest broker never actually sees the raw identifiers. Again, they only receive those de-identified tokens. And the benefit of the three-party model is that it reduces the amount of direct sharing or coordination needed between the two data owners, and can also provide an extra layer of separation that improves privacy and security. So again, key takeaway here is that PII never leaves the data source, only the encrypted tokens. So some benefits and use cases of PPRL and more broadly data linkage. PPRL facilitates the broader sharing of linked data belonging to an individual because that data is de-identified after linkage. PPRL helps to address or track a patient's journey through healthcare or research by linking data sets collected longitudinally across various time points to advance, let's say, precision medicine or public health priorities. PPRL also can enrich different types of data, such as EHR data, social determinants of health, genomic data. Real world data has been a buzz term, which is data collected in real health settings. So PPRL is used to link these different data sets, data types on the same individual across sources. And PPRL also helps to avoid costly duplication of data. So for example, if you have two clinical trials that are examining the same rare disease and they have overlapping participants, linking data between those two trials can avoid duplicating data collection and unnecessary costs, since the same patients are tracked, treated, and followed up with twice. An increasing amount of agencies and programs across the Department of Health and Human Services are using PPRL for data linkage to advance research and public health outcomes, including for applications like precision medicine, patient-centered outcomes, epidemiology, and population health, just to name a few. And linkage in PPRL has also been mentioned in a couple of federal initiatives and policies, including the NIH Strategic Plan for Data Science issued by ODSS. And so a couple examples where it's used is the NCI Surveillance, Epidemiology, and End Results SEER program uses PPRL to link patient registry data across state and local jurisdictions. And they also link that registry data with claims data to provide an enriched data resource that can be used for a wider variety of epidemiology and health services research. FDA uses PPRL to link outcome data and EHR data for product surveillance, such as post-clinical trials. And then we also see PPRL being used at NIH to develop large-scale clinical research databases by linking research data with real-world data sources like EHR. So examples of that is the NIH All of Us program and the National Clinical Cohort Collaborative, or N3C. So I'm not going to go too much into N3C and All of Us, but during next month's webinar, we're actually going to do a deeper dive into using real-world data for research and considerations. And we will also be bringing in speakers from Datavant, who is actually the PPRL vendor for both All of Us and N3C. So a researcher or organization that's interested in implementing data linkage or PPRL should consider 5 essential elements. That is the participants, the data, the PPRL tool, the governance, and the data platform. And these components all intersect at various points in the data linkage process. So let's walk through some of these key elements involved in privacy-preserving record linkage. So the first essential component is the participants. So participants, individual participants, are really at the center of any data linkage effort because it's their PII that makes the linkage possible. So gaining and maintaining their trust is critical, as we talked about earlier. And participants need to understand and consent to how their data will be used. And they must have that confidence that their information won't be used or shared beyond what they consented to. So in general, it would be a best practice to obtain participant consent for linkage and sharing their linked data prior to data collection by including explicit language in the informed consent. So again, prior to data collection. In cases where the data was collected in the past, and you're looking to link that data, re-consent may be needed, or an ethics board or IRB might need to approve the use of that data for linkage, especially in situations like public health emergencies where consent waivers may apply. And that's what we kind of saw with the COVID-19 epidemic with linking data. Next is the data itself. So for PPRL and data linkage in general, you want to be using high quality standardized data for tokenization and linking. The quality of the PII used for encoding is critical for generating the tokens and creating those subsequent matches with high accuracy. And PPRL tools actually often use probabilistic matching to statistically infer matches with a high degree of accuracy if there is any deviations or missing PII. So for example, if in one record you have somebody's maiden last name and then their married last name in a different data set, these PPRL tools can infer that this is the same person based on a combination of their other identifiers. However, this shouldn't be the default or something to rely on. Ideally, you want to have complete PII and also be considering using common data elements or data models because it's, as we all know, it's less efficient and more costly to standardize data after it's been collected. And then in regards to selecting a PPRL tool, there are open source options, and we'll cover some examples of those on the next slide. There also are proprietary options through vendors such as Datavant and HealthVerity, who do PPRL more at the enterprise level. You'll need to consider whether the necessary PII is available in the data set to perform linkage. So certain PPRL tools require a minimum set of PII to have accurate linkage. And it might also be important to consider whether the tool can handle large or growing volumes of data. For example, if you're linking data longitudinally for a large study. And then governance, this is also very important. This provides the rules of the road, so to say, for how we collect, link, and share and access participant data. So these rules are shaped by the participant's consent, by a privacy board or IRB approvals, and by the policy of each data source. So for example, data collected under HIPAA might need to be fully de-identified or provided as a limited data set after linkage with additional safeguards like data use agreements that define terms that prohibit attempts to re-identify participants. And then finally, we have the data platform. So protecting privacy and security also means keeping participant data in a secure environment at every stage from before linkage, during linkage, and after linkage when the linked data is ready for analysis. And platforms hosting, government-sponsored data must comply with federal security laws and programs like the Privacy Act, FISMA, and FedRAMP for cloud systems. And so another thing to consider as linkage projects grow, we also need to consider platforms that can scale to handle larger and larger amounts of data securely and efficiently. So in summary, the key takeaways to take into account when implementing PPRL is instilling trust among participants whose data are to be linked and shared, using high-quality standardized data for tokenization and linking, establishing rules for linking and using the linked data, ideally through standardized data use agreements, and then mitigating any potential for re-identification of participants when linking data sets. So this could be through deductive disclosure review or the use of other privacy-enhancing technologies like differential privacy, which we'll talk about in a minute. These are some examples of open source PPRL tools that are freely available. I won't go into too much detail in this slide deck, but this slide deck will be posted on the NIDDK CR website after this webinar, and we have links to the documentation for each of these tools. So encourage attendees, if you're interested and want to dive deeper into any of these tools, to look at the documentation. And then resources for further reading. We co-authored 2 in-depth reports for the National Institute of Child Health and Human Development, and these reports were on assessing the feasibility of PPRL for linking pediatric COVID-19 data across HHS. And both of these reports are posted on the NICHD ODSS website, and we've included links here as well. So these both go into detail on the governance considerations. They also provide an in-depth assessment of open source and proprietary PPRL tools. So for these reports, we had done a very in-depth environmental scan and also interviews with various PPRL vendors. So includes many details. It's a 100+ page report. So any details I may have missed today, you'll find it in the reports. And then we also included the White House Office of Science and Technology Policy report on the National Strategy to Advance Privacy Preserving Data Sharing and Analytics. So with that, I'm going to pass it to Shruti now to talk about differential privacy. Thank you for listening to the PPRL part.
Thanks, Anya. And thanks for that great overview of privacy preserving record linkage. All right, if we could go to that next slide. All right, so now that we have seen how data sets can be securely linked across different sources without exposing individual identities, I'd like to take it one step further. So how can we analyze these linked data sets in a way that ensures that even indirect inferences such as relinkage attacks don't compromise privacy, right? So that's where differential privacy comes in. So differential privacy is a mathematical guarantee that the insights that we share from linked data sets won't allow for re-identification of an individual, even in the presence of auxiliary information. And then taking it one step further, differential privacy can also be used to generate synthetic data sets, right? So in the health space, synthetic data sets can be used for simulations, biomarker prediction research, ML modeling, algorithm testing, and of course, education and training purposes. And it being synthetic data, right, there is not too much concern around privacy and relinkage because the data within this synthetic data set is completely synthetic, right? So there's no real data within the data sets themselves. But more on this later on the presentation. First, let's cover how differential privacy actually works. So an algorithm is considered differentially private if by looking at, oh, can we actually go back to, yep. An algorithm is considered differentially private if by looking at the output of the algorithm, an actor wouldn't be able to tell if an individual was included in the original data set or not. This is accomplished by adding noise to the data and or the algorithm, and it allows for protection against relinkage. So in this case, programming code and parameters used to generate this privacy model can be made public. However, of course, the original data set and the data points with the noise added cannot be made public. If we go to the next slide. So why should we care about differential privacy and how does it bring value, right? So here's a quote at the top of the screen here from Professor Cynthia Dwork, and she is one of the founders of differential privacy. She mentioned that differential privacy allows the US Census Bureau to protect against increasingly sophisticated reconstruction and re-identification attacks that threaten the confidentiality of individual census responses, right? So here she's referencing that the 2020 US Census was one of the first censuses, right? Or the first instances of a government agency implementing differential privacy to analyze and release data sets. So if we're looking to break down the benefits of differential privacy, there's 4 key areas. So resilience, privatized data can be released without increased risk of disclosure due to the underlying mathematical guarantee. And these guarantees cannot be provided by previous methods such as record swapping or table suppression. There's increased transparency. So as I mentioned, we can release code, we can release tuning parameters, and the decision-making that was used to generate the privacy model. And then the privacy model itself assumes that all information within the data set is identifiable. So it eliminates the need to define the data elements that once put together could potentially identify an individual. And of course, it increases trust, right? So when users are aware there are multiple safeguards put in place to protect their data, they're more willing to participate in research and data sharing initiatives. And I would venture to guess that all of us have actually been subject to differential privacy algorithms without us knowing about it. So if we go to the next slide, there's 2 different flavors of local differential privacy, or of differential privacy, local differential privacy versus central differential privacy. And the one that we've all likely been exposed to without us knowing about it is the local differential privacy piece. So if you own an iPhone or a Google phone of some sort, the crashed reports, the quick type suggestions, emoji suggestions, lookup hints, all of that information from your phone is actually sent to the servers of these companies using a differentially private algorithm in which noise is added on your device prior to sending this information upstream. And essentially Apple and Google use local differential privacy to obtain information on use of various features within your phones, your laptops, et cetera, to then create a better user experience. Central differential privacy, on the other hand, is when aggregated data has noise added to it, and that noise plus the aggregated data creates a secondary table of sorts of statistics. And this is the central differential privacy element of this is what the US Census Bureau used to create their summary tables and statistics regarding the US population. So if we go into the next slide, there is some more information here regarding the different privacy methods that the Census Bureau uses to ensure the privacy of participants. Research shows that respondents' concern for privacy is among one of the top reasons for unwillingness to participate in the census. And so multiple methods have been put into place for preserving privacy of the individuals participating. So, it started with stopping publishing on some small areas where it's much easier to relink data back to the original individual that provided that information, right? So in small populations, it's much easier to see who is the outlier. In the 70s, they started doing whole table suppression. In the 90s, it was data swapping, and in 2020, they integrated differential privacy techniques into the census. And they used a top-down algorithm, meaning that they injected noise into the largest cohorts and then went down into the smaller subsets. So for example, they'll look at national data, then look at state-specific data, then country, then city data, and integrate noise from a top-down approach. And so, okay, so differential privacy is now integrated into various applications, from government agencies to the technology that we use every day. So how does this actually work? So if we go to the next slide, we can get into the math. So the goal of differential privacy is to force outputs to be so noisy that no individual has much influence on the analysis. So the analysis in this case being the target function plus noise. So if we were to look at the example in this purple box on the right here, let's say you are attempting to calculate the hazard of patients experiencing kidney failure or death in individuals with chronic kidney disease, right? So this is your target function, so to speak. And so in order to answer this question, you would have to know your DT, so the number of events at time t, and NT, so the number still at risk before time t. And so in order to privatize your answer to this model, you would pick an epsilon, which is one of the tuning parameters of differential privacy, and we'll discuss that in a bit. And we'll take DT and NT and add a bit of noise based on your epsilon to those variables to create your D prime and N prime, and use those to create your hazard prime, right? And so in differential privacy, if you have two, well, I guess let's back up a bit. So let's say you have database 1 and database 2. Database 1 and database 2 are identical, but the exception is database 1 includes Joe's data. And so let's say you're running your hazard analysis using both data sets, and you get answer A versus answer B. You will get complete privacy in your algorithm if there is no difference between answer A and answer B, because the amount of noise added makes it such that the integration of Joe's data makes no difference to the answer, right? So you can see that there's a trade-off already between data utility and data privacy. And if we go to the next slide, we can look at the tuning parameters. So as I mentioned, epsilon is the key variable here that is used to tune how much noise is added to your analysis, so your target function, right? And so the more noise you add to your hazard function, you might not get the true hazard of your underlying data. So if person A's data is in the data set versus removed, the probability of getting any output changes at most by a factor of e to the epsilon. And we can reduce the impact of noise by increasing the sample size. And generally, this works with local differential privacy with companies like Apple or Google because they're getting large volumes of data. However, that methodology may not be applicable to a healthcare clinical trial use case, right? And so something to keep in mind. And any additional queries against the same data set will reduce the overall privacy because now you're releasing more information about the underlying data set itself, which will actually increase your epsilon, so weaken your privacy factor. And so when we're thinking about our privacy budget, so our privacy budget being epsilon, and if we go to the next slide, we can get a sense of how to set epsilon by looking at our study design and how sensitive our underlying linked data set is. So study design wise, you want to consider things like who are your data users, right? If your data users are external, public facing, then more noise may need to be added in order to ensure protection of the individuals within that data set. If your data users are internal in a controlled environment, less noise can be tolerated in that specific instance, right? What is the intended use case of your query results? So scientific research, machine learning will require higher accuracy, and so ideally a lower or a higher epsilon value, right? But public statistics that are released, such as the US Census Bureau, you'll be able to tolerate larger noise additions, partly because the US Census, there's large volumes of data that are coming into the analysis. And then finally, what is the sample size of your study, right? So this goes back to how many participants do you have, and can you still see the patterns emerge if you have 100 versus 2,000 participants versus 200,000, and so on. Mathematically, when we're setting epsilon, we want to take into consideration how sensitive our data is. And so you would measure sensitivity by iteratively removing one row from your data set and actually analyzing your true hazard and seeing how each participant actually changes your final overall hazard function. You can also look at k-anonymity and L-diversity measurements, so gauging almost like your k-means, right? Seeing how your data clusters together, and then within each cluster, seeing if there are differences within your sensitive attributes. So if all your quasi-identifiers within a K cluster are the same, are there some sensitive attributes that do differ within that? And essentially, the more sensitive or your data is, the larger impact each row has on your output, right? And so the higher your epsilon will need to be. And so from these considerations, you can then move on to setting your epsilon. And actually on the previous slide, there was a table regarding, if we can go back one. Yep. So there was a table regarding your epsilon and how this confers noise. So there's no hard and fast rule, but in the literature, you'll find that 0.01 to 1 is heavy to moderate privacy protection. versus 5 to 10 range is weaker, and everything in the middle is a little bit more moderate. And you would choose this number based off of what your intended end question is and who your data users are. And yeah, so with that information, we can move on to discussing how this can be used to generate synthetic data sets, right? So the benefit of synthetic data sets overall is it protects privacy of individuals in the data because none of the data is real, right? However, the data in synthetic data sets should model what real underlying data for a specific population would look like, right? So you would want to preserve the relationships between the variables and the data elements as best as possible. And if you're able to do this, it allows increased and faster access of research to healthcare data. And it addresses the lack of realistic data for software development and testing. And then if we move to the next slide, we can get into how we can use differential privacy to generate the synthetic data set. So you start off with understanding the basics of differential privacy, epsilon, and your tuning parameters. You'll want to understand how variable your data set is when you're looking at it holistically, and if there are any outliers or how your data set in general clusters together. Using that information, you would set your epsilon, and then you would run some data cleaning, imputation, and domain setup. So ensuring that data is consistent and there are possible ranges for each variable. You would then privatize a model of the overall data set. So you can use multiple different methods to do this. Marginal method, probabilistic graphical models, and GANs, so generative adversarial networks. And so in these models, what you're attempting to do is preserve the relationships between the variables in your real data set, however, add an element of noise dependent on your epsilon so that you have preserved the privacy of the model, and then use the model and the outputs of that model and sample from that model to create fake individuals. And so in the next slide, I have an example of this. So say you manage a large NIH-funded cohort study using electronic health records to track patients with type 2 diabetes across multiple health systems. A collaborating team requests patient-level data to develop models predicting risk of diabetes-related complications such as kidney disease, retinopathy, et cetera. And they've requested variables including lab values, medicine history, comorbidities, demographic factors, et cetera. So how can differential privacy be used in this scenario so that you are not actually sharing real patient data, but you are sharing synthetic data that preserves the relationships within the real data so that this secondary research team can still use the data to run their modeling studies. And so on the left here, we have our real data set. Let's say you have a patient ID, age, gender, A1C level, BMI. Of course, in a real world scenario, there will be additional information here. And this is a very basic model, but if we move through this, we would pre-process the data. So differential privacy assumes bounded domains. And so you'll gather information on the data attributes that are required. You're standardizing the data formats and creating bins for continuous variables. So for example, for age, you would create a bin for all patients that are between the age of 40 and 55. You would impute and standardize data elements within a data set. So any NA values, et cetera, you would want to standardize how those show up. And then you could use a marginal model. So you'll compute a K-way marginals to learn about the underlying data set, right? So A1C times BMI, age times gender, fasting, blood plasma glucose versus waist circumference. And you're preserving these relationships, so to speak, using this marginal methods. And then you're adding an element of noise. So let's say you've run this marginal method and you have this table at the center here. So now all of your ages are grouped into specific bins. You have a gender column. Your BMI is limited to overweight, obese, and underweight, normal weight. Your A1C is binned to a range, and now you have counts for each of those groups of patients within this table. And so a very simple example of this, you can add noise to your counts. So you'll take your true counts and then you'll add an element of noise based off of your epsilon value and what's called a Laplace distribution. And then in the next slide, you'll be able to see that you can sample from those noisy counts and create fake patients, right, that still preserve the relationships between the variables in your marginals. However, this data is now completely synthetic. The patient IDs are no longer real, and the information within each row, though preserving the key features and relationships, are not actually representative of real people. So once you're at the stage of you've generated the synthetic data, what you would want to do is, as the person who will be distributing this, you could run some of your own analyses on this to compare, the performance of this data set within an ML question. Like maybe you want to look at the risk for developing kidney disease based off of some of these factors. You could run your own ML model to then look at the real data versus the synthetic data to see how well attuned those two different data sets are. You can compare the noise of synthesis to the noise of sampling error. And in general, this would be helpful in that you would not be sharing real data. However, the models that are generated, as long as the synthetic data truly does live up to the relationships that you see in the real data, you'll be able to then take the models that you develop on the synthetic data and apply them into real patient data sets. Benefits of synthetic data, again, are, there's very, very low risk of re-identifications, and there's low risk of drawing incorrect conclusions. And this is with the asterisks of, as long as the relationships are maintained within the synthetic data set. And then on the next slide, we have some open source differential privacy packages in the languages that they are written in. So Google has a differential privacy package. If you're more familiar with R, diffpriv works pretty well. IBM, TensorFlow, and actually Apple has their own differential privacy package as well. And so all of these provide the key analytic features, so the noise mechanisms, distributions that your epsilon would be sampling from in order to generate this noise element. And they're written in different languages, so you can pick the one that you're the most comfortable with to get started on testing some of these items. And then next slide, Anya, did you want to take the summary?
Yeah, sure. Just to summarize then, so what we discussed today, in today's world, the best practices, under the DMS policy emphasize controlled access and ongoing governance that can evolve as risks change. So not just one-time de-identification and release. And then privacy enhancing technologies like differential privacy and PPRL provide a stronger formal privacy protection beyond just de-identification. And then there's also sometimes not a one-size-fits-all solution. So researchers, organizations might, they should evaluate the technical feasibility, governance readiness, and legal alignment. I talked about the, necessary components for implementing PPRL, all the elements that should be considered. And oftentimes combining PETs may offer the best solution for complex privacy challenges. So what we discussed today with PPRL, you're linking data across various sources, you're creating a enriched data set that still is de-identified after linkage, but again, there is that increased risk for re-identification because you have more characteristics on the individual. And so using that in combination with something like differential privacy or even manual methods like deductive disclosure review would be the best to really make sure that you are maintaining the participants' privacy and confidentiality. And then now with the last, I think we have some extra time for Q&A, and then there'll also be a poll on the screen just to give some feedback on this webinar and any suggestions you may have for future webinars. And our contacts are here listed on this slide if you have any questions. And then the upcoming webinar is going to be on challenges, opportunities, and considerations for researchers using EHR and real-world data sources. This is going to be on July 31st from 2 to 3 o'clock. And experts from Datavant are going to come and present. Datavant is a PPRL vendor that works with all of us, N3C, and a couple of other agencies across HHS and beyond to perform PPRL. And they'll do a quick demo on PPRL and also share their experiences with all of us in N3C, which is a real-world data resource for researchers to use. And we have the QR code to register. But thank you all for attending. I think, Rebecca, should we go through the questions in the chat? And then if there's any additional questions, we can unmute participants. Feel free to raise your hand.
Yes, excellent. Excellent presentation to both of you. We do have some questions in the chat and in the Q&A feature. I suppose this for either of you. Can you share some of the resources on how the tokenization works? They're trying to understand how the links are made without uniquely identifying that both sources are about the same person.
Yeah, I'll suggest for this, it was in the earlier slides on PPRL, the linked resources that we had on that slide. So in those two reports for NICHD, it really goes in depth exactly how the tokenization process works, and then an assessment both of the accuracy and the actual privacy of various PPRL tools, both open source tools and these commercial enterprise level tools were assessed. So I would suggest those two reports, and again, these slides will be available and posted to the webinars page after this webinar.
Thank you, Anya. There's also another question, and I suppose that this is simpler to answer. Is that the question is, are trusted research environments? And I suppose that the question meant consider PETs. And from an NIH perspective, I will say, and of course, Anya and would like you to provide some thoughts. But I think that from NIH perspective, a trusted research environment is part of a comprehensive approach, but not enough on themselves. Anything to add?
Yeah, I would agree with that statement. Trusted data environments are not the same, they're not considered PETs the same way as like differential privacy or homomorphic encryption or federated learning. They're more of a broader concepts encompassing larger systems. So more of like a framework for a system that may incorporate also PETs, but I wouldn't consider them a PET itself. I don't know, Shruti, if you had anything to add to that.
Yeah, I would agree there. Typically how I've seen privacy from start to end in something like a cloud infrastructure is there's actually multiple points in which you're hitting privacy to safeguard patient information, right? So within a protected environment, there are still the additional safeguards of, if you have linked data, running additional algorithms such as differential privacy or linking data within a protected environment. So I think it can be part of a larger privacy solution. And typically there are multiple privacy solutions within a infrastructure in any case. So, but agreed that it's not necessarily privacy enhancing technology in and of itself.
Thank you. And then there's another one that says, isn't there a potential leakage to the data custodian in a two-party model and to the honest broker in a third or three-party model? Can you talk to this or share a little bit more information about the potential for leakage?
Yeah, and so PPRL tools are designed to avoid this type of problem with data leakage and any PII actually leaving the data source. So typically with these PPRL tools, each data source would install that tokenization software, at their institute, and so from there, the PII gets tokenized, and then only those tokens actually leave or get transmitted from the data source to, if it's a two-party system, to the other party that's doing the linkage, the other data source, or to a trusted data broker. An example is like Registreef is a trusted data broker for a couple federal projects, but in that sense, it's intended for that not to happen. Of course, I'm sure there could be instances where a breach could happen, or if things, maybe the token is not complex enough. I would say it would depend on the specific PPRL tool that you're using, and there's different tools and algorithms. When you're looking at these commercial vendors like DataVan and HealthVerity, they have actually, FedRAMP certification and authorization to ensure that these kind of breaches don't happen. But of course, if you're using open source tools, I would definitely do in-depth research and really understand how it works to make sure that this kind of situation doesn't happen. But I would say this would be a very rare instance with like a FedRAMP certified commercial or enterprise tool like DataVan or HealthVerity.
Thank you, Anya. And I don't know if it was just me, but for at least on my end, you broke up a little bit. So
My apologies.
I encourage now, if anybody has additional questions, please post them in the Q&A or the chat feature. Also, the central repository does offer PPRL features. So if anyone in attendance is a potential submitter that is eligible to submit and is in the planning stages, I encourage you to contact us to talk about potential PPRL usage for your study. If there are no questions in the chat or from the audience, I think we can adjourn this meeting early.
Good.